Welcome to another episode of In Office. I am Dr. Jevan Samuels. In office with me today is nurse Shamel Allen, and she's a practical nurse here in Jamaica. Welcome to the show, Nurse Allen.
Welcome.
All right, good.
Yeah.
Now, today basically on my channel I want to discuss the life of a practical nurse. I just want to get the insight as into what you guys do in terms of the day-to-day activities. Can look at the qualifications to get in the years of studies and also look at some other social stuff. All right.
Okay.
Now let's. What exactly do practical nurses do in Jamaica?
So a practical nurse is a trained nurse, referred to as patient care assistant.
Yes.
So you'll get training for 1 year. You can go to UWI off campus. You have distinction, and you have several other. You will requirement is 3 sexy subjects.
Okay.
So we have English, it can be social study or a science subject.
Okay, so there's 3 subjects is required, so, but
Yeah.
definitely English, social study, and a science subject. Okay. All right. And but in terms of the day-to-day activity and the job, what are in terms of the training then? What are some of the stuff that you guys normally get within that 1 year of training?
So the 1 year of training is total patient care. So total patient care is based on ensuring that the patient hair is combed, teeth is brushed,
Yes.
body is clean, and the environment of the patient is clean in terms of the bed and everything. So
Okay.
it's total patient care in terms of everything about the patient is clean.
Yeah, okay. But some practical nurses in some institution, I realize that they are involved in like doing vitals or they measuring the output of the urine or from the NG tube drainage.
Yes, that is also a part of our duty. In some facility,
Yes.
the vitals are not done by the PC, but PC are trained to do vitals and other stuff, but it's based on where you're at.
Okay. Alright, so some institution they will do the vital, but some they just stick to the hygiene needs of the patient.
Okay, yeah.
Alright. Some patients normally are in critical state, so they're on plenty oxygen. Sometimes they have in several tubes, sometimes they have several dressing. What are some of the precautions you guys take when you're doing patient care for these
So when we
critical
are,
patients?
okay, so when we are doing those patients, we are supervised by the nurse. So the nurse is at the bedside with us. So
Okay.
at that time we are assisting the nurse. So it's the nurse core duty now to do most of the stuff for the patient. So we just assist with the patient when they are critical.
Okay, alright. So in terms of the whole patient care, that sometimes I'm seeing where you have some patients are a little stubborn. So sometimes they probably able to walk and can help themselves, but they feel entitled to be showered or their hygiene needs been met by the practical nurse. How do you normally handle those patients?
So first you approach the patient, good morning, greet the patient, and you explain to them what is going on. Because some patients, when they come to the hospital, even though they can walk and do everything for themselves, they feel like they don't, most of them don't know. They said once they're in the hospital, you're supposed to take care of them. So we'll explain to them and let them know that, listen, fam, you can do it, you do it yourself, so that when you go home, you can manage yourself. So we explain to them what is needed to be done. So explain to them that, hey, you need to get up and go tidy yourself because you can manage yourself.
Sometimes I realize that patients in diaper, bedridden, sometimes I realize that even in the hospital setting, sometimes they develop like diaper rash in the ear, especially if they are long-standing patients. What are some of the factors why we think that sometimes we don't have we're not changing them often enough, or sometimes I think that sometimes they may just have diarrhea or some other factor. What are some of the factors which causes high prevalence of diaper rash in healthcare setting?
Okay, so Sometimes it's the turning, the pattern in the turning. So we normally would turn the patient, but the patient will go back on the side that the injury is.
Okay.
So that cause a problem. So you turn them, set them the way, but they turn back on that side. Sometimes I can say the diaper, because people are allergic to stuff. So
Okay.
the different diapers. So the family bring one today, tomorrow they bring another one, or the institution have a special one that will work with the patient. But majority of the time it's the patient going back on the injury that causes him to have the bed sores.
Okay. Right. Sometimes some of the bedridden patients, I'm on the ward, I'm doing ward rounds, and sometimes they complain that they haven't been changed in a while. All right. How often do the practical nurses check the patient, especially if they are bedridden and sometimes they have stroke and they can't readily call up for a nurse or to help them? Or is it that we have a time period, we check their diaper, or we just have a 2 session that we just walk through?
Okay, so there's 3 main time that we go through. We go through in the morning, we go through in the afternoon, and we go through in the night. But being that it's patient care, we're gonna always be checking them for to ensure that the patient is clean, because that is what we're here for. So it's not a specific time. Once the patient is messed up, we have to go through and change that patient. It doesn't have a time. But as we say, we have a time that we go through.
Okay.
Once the patient mess up, we have to deal with the patient. Sometimes the patient can be confused, so they call out to say, oh, doc, I'm wet, oh, nurse, I'm wet. But when you go there, they're okay.
Alright, not trying to throw the practical nurse under the bus, but in terms of sometimes some patients with stroke, sometimes some patients may just need like soft diet, and you have to be patient with them, allow them to sometimes it will take a while to chew or to drink their soup or their porridge, right? But I'm seeing that several times. I'm seeing a lot of patients with aspiration, pneumonia, and sometimes I'm wondering if it's the technique, if they're feeding them too flat, or they're not patient enough to allow them to chew properly. But what's your take on where that is concerned?
So my take on it is, I'm speaking for myself.
Yes.
So we ensure that the patient is propped up in the bed, and we take our time and feed them. You understand? So
yes.
we take our time and feed them. So that's my take on it.
Okay, alright. Now NG tube. I know that sometimes NG feed in the hospital setting, it may be the practical nurses that do it. But from time to time, patients in nursing homes, sometimes are practical nurses only there. Where you guys also train how to manage NG tube and check for placements, etc.?
Alright, so it's based on where you get your training. So I can't call out the school names, but
yes.
it's based on where you get your training. So it's the institution that deal with that. Some institutions don't, some do.
Okay, alright. And in terms of being a practical nurse, and what are some of the good experience or fulfilling moments that you get from being a practical nurse? What motivates you to continue do this thing every day?
So my take on that is that when you are going in the field of practical nursing, you have to have a general love for people.
Okay.
You have to love people. You have to be willing to sacrifice certain things. You understand me? It's all about your personality, how you deal with persons, how you communicate with them. Good morning, sir. Good morning, ma'am. What can I do for you? And it's all about love. It's all about love. So you're coming into the field, you have to generally love people to be a practical nurse, because there are days when it's very rough, but you just keep pushing on because you are helping somebody. You are in the process of helping somebody to become whole again. Because when they're in the hospital or the nursing home, that means they're ill or something's wrong with them. So you being a part of their well-being is just an exciting feeling.
Okay, all right. Now, sometimes we know that even though we try to care for patients, you're always going to have at least a few patients that tend to be disrespectful or they try to make fuss over everything. How do you normally deal with those patients that normally can let you have a bad day?
All right, so for example, one, you're gonna be firm. You're not their friends. You're gonna tell them, sir, this is this and that is that. You're gonna be firm. And you're not gonna smile up and laugh up. You're just gonna be firm.
Okay.
Because patient being disrespectful, I don't tolerate that. I'll go and I say, ma'am, I'm not gonna tolerate the disrespect. So you have to be firm when you're dealing with those patients.
Okay, all right. And sometimes I'm seeing where like the relatives would some relatives come and the patient probably still in like they miss. Say for example, they have stool or urine, the diaper is full, and they would still refuse to change the diaper there and want the nurse the practical nurse to do it because they think that they are supposed to do it even though it's their relative. How do you normally manage those situations?
So those situations occur regular, but you just know that it's your job and you just do your job. Because if the relatives come and they don't want to change their family, we just have to do it because it's our job.
Okay.
So we're gonna do it anyway.
Alright, we can divulge into like different relationship because practical nurse they are actually a wider member of a healthcare team, right? So we have the registered nurse, we have the doctors, have pharmacists, we have we call those LPNs, psychiatric aid, etc.
Yeah.
So it's a wide range of persons doing different jobs in the field, right? Plus you have the janitor, you have the porters, you have a lot of persons, artists and etc. So it's a physiotherapist, right?
Yeah.
With that multiple groups working together, what are some of the approaches that you take to ensure that you don't have conflict among staff members? Because I know that practical nurses, sometimes the doctors will ask the practical nurse to do something, sometimes the registered nurse will ask practical nurse to do something. Sometimes we know that we are short staff, so we are overwhelmed. How do you maintain to have a good relationship with all the different staff, especially the ones that you are taking instructions from?
Alright, so the core, my main thing about this is know your role and know what you're supposed to do and what you're not supposed to do. From you know what you're supposed to do, you can ahead. So once you know your duties and what you're supposed to do, thumbs up.
Okay, all right. And so in terms of the general work environment being a practical nurse, how do persons normally, in terms of their respect or how they see the profession of practical nurses here in Jamaica? What type of what should I say? What type of overview reviews that you guys normally get from the perception from the public in terms of if they see the job as significant or something outstanding or they don't have any, they just have disregards for your occupation?
Alright, so as it regarding to that, once you are out there,
Yes.
everybody just view you as nurse.
Okay.
Yeah, so everybody call you nurse. Practical nurse, registered nurse, enrolled. You're just nurse to them. But
Okay.
overall, it's very good. It's very good. You will have one person who will try to make you feel some type of way, but the overall is great. Excellent for me. Yeah.
Okay. All right. All right. We don't want to keep this interview too long, but sometimes persons watching this may be interested in becoming a practical nurse. You had mentioned about sometimes the requirements earlier, so it's not much requirements in terms of subjects. But what are some of the tips or advice that you could give someone who is interested in becoming a practical nurse?
Alright, so first, my tip is that one, I highlighted that you have to have a love when you're coming into the healthcare system. Second thing, you have to have 1 year training with a recognized institution, 1 year with a recognized institution, and you can have 3 or more subjects going into to do that. To come into any system, you have to have 3 or more subjects. Yes.
All right, I want to ask you specifically a question because I know your background coming from the community health aid.
Yes.
How do you like compare the life of a community health aide in comparison to a practical nurse, which is better, and why you switch from one occupation to the next within the same healthcare field? I was curious from then.
It's two different things: community health aid and PC. So the community health aid are the nurses that wear the blue. They go out in the community, so they find the persons that are sick and encourage them to come into care.
Okay.
Yes, the baby mothers, they find those mommy, encourage them to come in. Person that is diabetic and not taking their medication, sick and not coming in with. So it's based on going in the street with the community health aid. We have our days where we're in the clinics and we do the vitals. Their workload is a lot more than the PCA.
Okay.
Yeah, as it relates to the PCA now, it's total patient care, ensuring that the patient is clean, your ward is okay with the patient. So it's in the hospital, it is two different. Clinic and the hospital, it's two different things. So the hospital now, you're taking care of the patient, ensuring that the patient is clean up to the T.
Right.
So there's a big difference.
All right. So it's a different qualification to do.
No, it's the same.
So the same qualification, it's just
Yes.
different. Okay. All right.
Yeah.
So I understand. So the same practical. There are practical nurses
they are
as well, just that they are
they are
community
practical
healthcare.
nurses.
Okay. I was wondering why some would wear pink and then they wear blue.
Yeah.
But just because if they are in the community, they blue
Yeah.
uniform. Okay. So you didn't have to do any other different studies just to switch
No,
from that job to
no.
this. Okay. All right. And now basically coming to the end of this session, because I don't want it to be too long.
No,
Thanks very much
yes.
for coming here. But do you have any final word you'd like to say to the viewers about practical nurse patient care and the whole overall healthcare in general?
It is wonderful. It is wonderful. So you can come into the field.
All right, so Nurse Aline, thanks very much to take this time out of your schedule to come and have this interview with me. All right, and I hope. I wish you all the best for the future, alright?
Same to you.
But one other thing, normally at the end of this program, if the person have any business they want to advertise or any issue that they want to talk about pertaining to anything in life, this is the opportunity. They have social media page, I don't know anything. I just,
I'm a simple person.
you're a simple person.
Yes.
Alright, thank you.
Alright.
Alright, viewers, so this concludes the end of another episode of In Office, and please remember to share, like, subscribe and leave a comment on this video so you can reach as much persons in the community who want to know about the life of practical nurse and the requirements to get into the program. Until next time, take care.
Be sure to subscribe for more informative contents on life, sickness, and death.